Hi, everyone. I work at Clínicas de Salud del Pueblo. We're basically a health clinic. We're a federally qualified health center in Coachella. We also have a clinic in Mecca. And it's a primary care clinic, and I work with the behavioral health department there. So we launched a behavioral health program at the clinic about 6-7 years ago. And I joined the clinic when the program got launched. So currently, my title at the clinic, I'm a behavioral health care manager for a health home program. So I work with a team of people at our clinic that we help to coordinate the care of patients that have chronic illnesses like diabetes, hypertension, problems with their kidneys. And some of our patients also may have a history or are struggling with major depression or with some psychotic disorders like schizophrenia, bipolar disorder, or substance use. So we are working with some of our sickest patients at our clinic. So we have a caseload, it's a little bit under 200 patients. So it's intensive like case management that we provide to these patients. So I work with a nurse. I work with a promotora, which is a community health worker, and with a clinical care coordinator. And we work directly with one of our medical doctors in the clinic, who we consult with as sort of needs and issues come up with patients. So what do I do normally in a day? I am doing a lot of outreach to patients, checking in with people. How are things going? Any challenges that you've had? Have you had to be hospitalized? How are you coping with things? Are you taking your medication? Any issues around your medication? So I'm not necessarily functioning as a typical therapist, even though I'm a behavioral health person, lead person for this team. So it's not the typical therapist role that I would traditionally do. So I've been doing this for a couple of years now. And it's a lot of interpersonal skills, just being able to talk to people. Really a lot of cold calls that we have to do. So it's sort of over the years, I've been with this particular program for a couple of years. So I've developed some relationships with patients. So as soon as I call, like, what's going on, Maria? I'm like, hey, I just need to check in. How are you doing? How have you been this month? And so that's some of the things that I do with them. I work with Clínicas Monday through Thursday. So on my Fridays, I'm actually working with a psychiatric medical group, and I'm providing individual therapy on my end. So I'm consulting with them and providing those services to them. And I'm also doing an online counseling program in the evenings. So I am doing, I guess, the typical therapist job or role that we normally do on outside of my schedule with Clínicas. And I work with kids and adults, and I'm doing it because I enjoy it. And I think with the program I'm running now, I kind of got pulled away from that piece a bit. So it's kind of nice, and to be able to get sort of back into that setting. So where did I go to college? So I want to start off with where I went to high school. I'm actually a CV high school graduate. So I graduated from CV high school, and then I did undergrad at the University of San Diego. So I went directly to undergrad. I took a year off. I needed a year between undergrad and grad school. I took a year off, and I subbed at the local school districts for a year. I just needed to sort of gather my thoughts and figure out what the heck I was going to do and what I wanted to be when I grew up. So I took a year off, and I ended up sort of figuring out, like, I think I want to do social work. So I applied to USC. That's where I did got my master's from USC. And I've had, even though I'm in a primary care in a health clinic now, and I am working, as a therapist outside on my own with that regard, I essentially got started in this field as a social worker in hospital settings. That's really kind of, I feel like at times, like where my heart is in terms of that type of setting. I think I'll always probably refer to myself as an ER social worker by heart. Like I was in I lived in LA for about 10 years, and trauma. I worked at Harbor UCLA in their trauma emergency room. So I really enjoyed that fast-paced type of, environment and setting. So I think that's probably how I ended up back in a clinic setting. So I kind of get a little bit of the medical stuff, and then I also kind of get to integrate my clinical social work skills. So And I think that's part of what I enjoy about this job, just being able to meet people in a place in their lives where they're oftentimes vulnerable, and being able to step in and provide that safe space for people to be able to open up and just talk about what's happening, and just being able to contain that for them. I find my job, what I do, my career, my passion, it's just really a privilege, I think, more than anything, to be in this position so that we're able to provide this to people. And I think it's just a shared humanity. I think that we all, are able to connect with people. What are some challenges? Oh, there's a lot of challenges. And I think because of the type of work that this is, I think it can take a toll oftentimes. So I think self-care, and I know that word self-care gets thrown out so much. It's like, what the heck does that even mean? But it is critical, I think, for professionals that enter this field to be able to know how to practice that and put that into practice, and just continually sort of be checking in with yourselves, because we're in a space with people where oftentimes we're absorbing that energy, and being able to sort of balance that out. So I think that sometimes can be challenging if you don't have a good network of colleagues that you can consult with and process and talk about what's happening and what's going on. And I think when you first leave grad school, you have that support system. As you become licensed and more independent, you kind of drift off on your own. So it's really critical to be able to continue to find that village and people, colleagues that you're able to connect with. So I think that's one of the more challenging things that I've noticed as I've sort of evolved through my career path.